Assalamualaikum warahmatullahi wabarakatuh and salam UiTM di hatiku. In this video, our team will present a case study on kidney failure. Without wasting any time, I will start with the introduction of kidney failure. First of all, we should get to know the main character of this topic, which is kidney. Kidneys are bean-shaped organs where located just below the rib cage, one on each side of your spine. The size of each kidney is about 4 or 5 inches long. Kidneys play an important role in our body since it is responsible to maintain the homeostasis, removing body waste, and keep the right levels of electrolyte in our body. Now, it is time to know about kidney failure. As we know, a normal human are born with 2 kidneys, but there are also a few people who born with 1 kidney. However, people who born or live with 1 kidney still can be live as long as the kidney in a good condition. Kidney failure happen when one or both of your kidneys no longer work on their own. This will cause human body becomes overloaded with toxic if both kidneys are not able to function properly. There are kidney disease stages according to estimate glomerular filtration rate, which is EGFR. EGFR is a calculation of how well kidneys filter substance. A normal EGFR is about 100 and the lowest EGFR is 0, which means there's no remaining kidney function. The stage start from 1 and end with stage 5. Next, I will explain 5 types of kidney failure. First, acute prerenal kidney failure, which caused by insufficient blood flow to the kidneys. Second, acute intrinsic kidney failure, which is caused by physical impact or an accident where directly bring trauma to the kidneys. Third, chronic prerenal kidney failure. It happens when there is not enough blood flowing to the kidneys. Fourth, chronic intrinsic kidney failure. This happens when there is long-term damage to the kidneys due to intrinsic kidney disease. Fifth, chronic post-renal kidney failure. This is because of a long-term blockage of the urinary tract prevents urination.
Assalamualaikum and hi, my name is Nur Isati Shazwani binti Muhammad Nur Anwari. So now I will be explaining about the main causes of kidney failure. Firstly, diabetes is the main cause of kidney failure, which makes it the most common cause for kidney failure. About 1 in 3 persons with diabetes will develop chronic kidney disease that will lead to kidney failure. This kidney disease can be a complication to both type 1 and type 2 diabetes patients. So how kidney failure was developed from chronic kidney disease? A condition known as hyperglycemia happened due to the kidney blood vessel and therefore located in the kidney were harmed by the increasing of diabetes-related blood sugar, and it affects the blood vessel to become narrow and clogged. Due to the narrow and clogged blood vessel, it will cause insufficient blood flow in the kidney, so the kidney will not be functional to filter albumin, which is a type of protein, and it will flow out with the urine where it should not be. High blood pressure is the second most common cause of kidney failure. Due to high blood pressure, the blood vessel will become narrow and constricted, causing a reduction in blood flow, and over the time the blood vessel will be damaged, particularly in kidney. So the kidney will no longer become functional to remove waste and extra fluid from the body, and soon it will induce the elevating of blood pressure. The next main cause of kidney failure is glomerulonephritis. This happened due to the tiny filters in kidney that was inflamed and damaged. It may develop in long-term or short-term. Glomerulonephritis can be an independent condition or a complication from another illness such as lupus and diabetes. The kidney can get damaged by glomerulonephritis-related inflammation that is severe and persistent. Thus, the kidney function to control the blood pressure is hindered by glomerulonephritis. The last main cause of kidney failure is genetic disease. This genetic condition is known as polycystic kidney disease. Polycystic kidney disease causes cluster of cysts that are variety in size to form in kidney, and over the time the kidney will expand and not functioning well. The cyst is fluid-filled, spherical in shape, and non-cancerous site.
Okay, so for main factors of kidney failure, the first point is heart rate. Higher heart rate than normal can actually be bad for certain person. This is because increased heart rate can actually give bad effects on the kidney itself. This will cause it to have bigger estimated GFR declines, or GFR, also known as glomerular filtration rate. This can causes high likelihood to develop proteinuria, and for middle-aged and older person, they have 1.1 higher chance to develop CKD, or also known as chronic kidney disease, and 1.2 chance higher to develop proteinuria themselves. And for the second point, I'll be talking about obesity. Basically, obesity can cause multiple complications that amplify the chance to get chronic kidney disease. Some of them are thrombotic condition, hypovolemia, and oxidative stress. Uh, Oxidative stress, for example, uh, excessive intakes of medications, drugs, vitamins, all of them uh, can affect kidney of someone. It can give bad effects to their kidney. And also, having high BMI also means having extra weight in the abdomen area, causing higher risk of chronic kidney disease.
I'm Anis Irina Bintiazi, and the topic of my presentation will be treatment for kidney failure. The most known kidney failure treatment is dialysis and kidney transplantation. People with kidney failure mostly reside in the elderly. They mostly suffer from multiple medical conditions and are ineligible for kidney transplants and only left to do a dialysis. And the dialysis consists of two types, which is hemodialysis and peritoneal dialysis. The hemodialysis works when two needles are in place on the arm. In addition to being attached to a tube through which the blood can pass to the dialyzer, which serves as filtration station for the blood, the machine pumps blood inside the dialyzer prior to entering it, and it monitors the blood pressure, as well as controlling how fast the blood flows through the filter and how much fluid is removed. In a dialyzer, there are three main components of a dialysis fluid. That is also can be called as dialysate, which is water, electrolytes, and salts. Dialyzer's balanced chemicals can be changed by a doctor depending on the patient's needs, such as the patient's blood having a 2 little amount of potassium. Upon entering the dialyzer, blood is forced into many small hollow fibers at one end, while on the outside of the hollow fibers, dialysate passes in the other side as blood passes through them. And waste from the blood will move into dialysate, but hollow fibers retain filtered blood and return it to the body. The hemodialysis can be done at home or the dialysis center. There is also peritoneal dialysis, which requires a surgical procedure to insert an abdominal catheter through the belly of the patient. After that, the belly receives dialysis solution from a bag that has water containing salt and other additives through a catheter and close the catheter with a cap when the bag is empty to continue doing other activities such as reading a book. As the solution sits inside the belly, it absorbs waste and excess fluid. After some time, the dialysis solution and waste products will deplete from the body into an empty bag that can be disposed in the toilet before starting dialysis with another bag of a new dialysis solution. This process, or exchange needs to be repeated for 4 to 6 times a day. Peritoneal dialysis can be done anywhere because it only needs a bag containing dialysis solution to do the job. The last step for kidney failure is a kidney transplant, where the procedure involves the surgical placement of a healthy kidney from a donor, be it from a living person or the dead into the patient's body. The procedure to find the right kidney is a long, tedious process because it is hard to find the perfect match. One of the process is a blood test to identify the human leukocytes antigen. Usually, if a patient's leukocytes antigen matches the donor's type, there is a very little risk of the body rejecting the kidney. After the surgery, the patient will have to take a lifelong immunosuppressant drug for the body to not reject the organ received.
Okay, next we move to the prevention and control where we can avoid ourselves from getting kidney failure. The first one is kidney function test, healthy and balanced diet, blood pressure, physical activities, tobacco usage and smoking, and lastly, medication. Okay, the first one is kidney function test. Regular testing allows your doctor to monitor your health and any underlying issues. We can determine how effectively our kidneys operate. An early detection and appropriate treatment are important in slowing the disease process with the goal of preventing or delaying kidney failure. The second one is physical activities. We can choose a continuous exercise like walking, swimming, bicycling, skiing, aerobic dance, or any other activity that requires us to work major muscle groups on a regular basis. We can do it at least 3 times per week, or at least we can walk for 45 to 60 minutes to maintain our body fit. And lastly, for medication, the doctor may prescribe our medications to help prevent and manage chronic kidney disease related to health concerns. The doctor may advise you to keep the blood pressure below 140 per 90 mg per mercury. But if you also have diabetes, the doctor may advise you to keep it below 130 per 80 mg per mercury. Angiotensin converting enzyme or ACE inhibitors are the most commonly used. Ramipril, enalapril, and lisinopril are a few examples, but the side effects may include a persistent dry cough, dizziness, tiredness, weakness, and also headaches.
Before we end our presentation, I can conclude that acute renal failure is a serious medical condition that could make the lives of many patients become more difficult. Despite significant advance in supportive care, the mortality rate from acute tubular necrosis is around 50% and has not changed much over the last 3 decades. However, mortality rates vary depending on the cause of renal failure. Rates in obstetric patients are around 15%, rates in toxic-related acute renal failure are around 30%, and rates in trauma or major surgery are around 60%. Infections are common in patients with acute renal failure. In fact, infection is the leading cause of the death in this patient. That's all from us. Thank you.